So when I visited repeatedly countries like China and in Japan, Indonesia, that's where really medicine merges with spirituality. And I learned that the majority of the population on this planet does not use the medicine that we all know as Western medicine. For example, China has 1.3 billion people, and the majority of them actually uses traditional medicine, which has very interesting components of spirituality. The Buddhist monks, they basically treat almost everything that any ailment with the meditation. And so there is no doubt that when we treat a patient, we have to treat the whole patient, which includes the mind, the body, and also the soul. And that's exactly the concepts that are used in Eastern country, in Eastern medicine. And one of the experiences I will never forget in my life was I had to give a talk in Hong Kong, and I had arrived there after 17 hours flight. And so I had a splitting headache. I mean, the worst headache in my life. And so I called the people that organized my lecture and said, listen, I cannot even get to the podium if you don't get me some Motrin, some medication. And they said, why do you guys use medications? I said, well, we have a headache. We use
Why would a doctor do that, right?
And the guy took me to, this guy was the CEO and the director of one of the largest hospitals in Hong Kong. And he takes me to the hospital. And the hospital, basically 2/3 of the hospital were traditional medicine, acupuncture, all those strategies. And 1/3 was our medicine. And he takes me to this professor. This was a professor in acupuncture. And this guy literally touched I don't remember whether it was the left or the right ear, with his hands. And, when you get ibuprofen, for example, it takes some time for the pain to go away, and this a process. I mean, my headache disappeared, the salt, in a fraction of a second. And this guy basically turned his back, left. They explained to me that is the way. And so I thought, why we cannot do these things in the United States? Because it's part of their culture. You cannot become overnight an acupuncturist. They don't study. It's part of their philosophy. It's part of the way they see life. It's part of their soul. And so that day I learned that, and then in other situations, like in Japan, when I had the pleasure of visiting some Buddhist monasteries, and I realized that medications is actually something that is not universal. It's something that we use in our culture, but there are a lot of people, a lot of cultures outside that instead use spirituality. They trick your mind, and through your mind that they basically are able to fix your soul. Initially, I thought it was just fresh water. And instead, visiting those countries, I realized that they had a very powerful healing system based on spiritual concepts, really. So
it's so powerful. I mean, really, our bodies are designed to heal. Yeah. We heal ourselves most of the time. A minor injury, our bodies repair overnight when we're resting. This is, it seems like, obviously we're aware of the traditional medicine, the concept of it, and that mind, body, and spiritual intersection. But that's a fascinating story. It also speaks a couple of things. Air travel, when you're traveling and doing speaking on the lecture set, it's not as glamorous as people would like to think. We'll have our stories. And I was, if you were in the United States, after that guy came in and saw you and touched your ear or whatever it was, they would have sent you a bill. So
yeah, there it was not an issue because they don't have any way to bill. It's just, it's a totally different.
Yes.
But the issue that we don't consider that as being scientifically proven is because nobody has done studies. I think that there is very good science indicating that our mind has an incredibly powerful control on the body functions. And by modifying our mind systems, we can affect a lot of diseases.
To this point, just think about that. I love the idea of researching this, but just let's work backwards. Look at all the issues that are related to stress.
Yes.
And so why do some people manage stress differently than others? And why are certain conditions exacerbated because of stress and the feedback that occurs within your body?
Yeah.
How that brain is interpreting some situation goes a long way towards the physical outcome.
I would expand the concept with a need that every CEO in this country dealing with the healthcare will probably agree with, which is we have a desperate need for more mental health and the behavioral therapists. Why? Because let's assume that I'm the best doctor in the world and you have diabetes. And you come to me and they give you all the right medications and all the right doses, and they tell you exactly what to do and so forth. And then I forget the fact that basically you are depressed. I'm not going to be able to fix you because it's much more important, the component of depression, than the actual physical disease. And if I don't fix your mental issues in a way or mood issues, that is going to affect your compliance with medications. I mean, if you're depressed, you're not going to take the insulin. So you're going to come back 1 month later and your glucose is still not controlled. And I can adjust the doses. But if I don't go to the root of the problem, which is that you have a fundamental issue with your mood, that is not going to reach the goal, which is to give you a better quality of life. And that is the reason why in several healthcare systems in this country, now they actually have psychologists, psychiatrists, behavioral specialists that built into the primary care clinics, because they finally start understanding that you just cannot cut the human body into pieces and treat them one at a time. You treat the pancreas, you treat the liver, and you forget that basically there are more pervasive issues that you have to deal with. And so it's that body-mind balance that is very much central to the way in the Oriental cultures treat disease, that we need to become more cognizant in this country. And the unfortunate problem is we have an incredible deficit of psychologists, psychiatrists, behavioral specialists, which I hope telemedicine is going to improve to a certain degree, but otherwise we have a big problem in that area.